Okay, there we go.
All right.
So we want to welcome everybody, but I want to say a special welcome tonight to Dr. Gill Wright, who's part of our forum. Dr. Wright is the Associate Medical Director in charge of clinical services at the Metropolitan Public Health Department. Obviously, he's a very busy person right now, so we wanted to start off with him tonight. Dr. Wright, welcome.
Thank you.
I think we started out, I have 5 questions that I really wanted to ask you about. And then if anybody else has any questions that they have for Dr. Wright, you are welcome to ask them as well. But they're pretty basic, the ones I have. Dr. Wright, can you tell us where we're at today with the COVID-19 virus in Nashville and Davidson County?
Sure. So the first thing we'll start with is just some numbers. In Nashville, Davidson County, as of this date, we've tested 7,661 people. We've had 785 positives. That's about a 10% positive rate. The distribution between men and women has been about equal. So that's where we're kind of at with what we've done testing-wise. We have set up assessment centers. There are 3 assessment centers, and those are at Nissan Stadium, near Meharry Medical Center, and out south on Murfreesboro Pike. I believe that one's like, it's an old Kmart. I think it was 2940 Murfreesboro Pike. But before you go to those sites, if you have a concern that you think you might have the virus or need to be tested, the best way to do this is to call the hotline that the health department has. That number is 862-615, obviously, 862-7777. It is open from 7 to 7, Monday through 7 days a week right now, and they are going to be able to answer questions if you have just questions. They're also going to be able to evaluate whether or not you should go to a site for testing. Obviously, all of the health systems have testing for their patients that are available also, and they're available every day. The assessment center sites are only available Monday, Wednesday, and Friday at this point. But you want to call that hotline because once people have been calling the hotline, we've been talking to them, and only about 20% have we felt needed to go to an assessment center, and if they went to the assessment center, that they would actually get tested. This is an assessment center, these are assessment centers, not testing centers. So they're going to evaluate based on your history, what kind of symptoms you're having, what kind of risks you have. There's a provider on site that is going to look at vital signs, that type of thing. And then we will test based on that information. On the sites, we've seen 649 people at the sites, and we've tested 404. So that's where we're at. I hate for somebody to go sit in line at a site that doesn't have any symptoms, because they're not going to get tested, and they're going to sit and they're going to get selected out, because this virus the testing's only positive when you're having symptoms. And so to go is not going to be of any benefit for you if you're not having symptoms. And so that's a good way to start, is to call the assessment hotline and talk with them first. Obviously, you can also call your personal physicians or hospital system and talk with them. They also have hotlines at the hospital systems here in Nashville, and their hotlines are set up and are going to assess the same way. We've all the systems have agreed to who needs to be tested and such, and we all are using the same guidelines. So to go to one and not another isn't going to change whether you're tested or not. So all of that said, the last thing I would add to that is that these assessment centers are for Davidson County residents only. So that's kind of a basic background.
Thank you. Can you remind us again how this virus is transmitted and what we can do to avoid getting it?
Sure. So this virus is passed by coughing or sneezing. When you cough or sneeze, then you have the virus. Even when you talk, you put little teeny particles into the air that carry some of the virus pieces with it. Now, coughing and sneezing obviously put a lot more of the virus into the air. So because of that, for those people that actually have the infection, very frequently a mask will be put on them. We're not putting or recommending masks at this point be put on anyone that doesn't have the virus. Part of that reason is that people with masks tend to touch their face more, and you can get this virus by having some of the particles on your hand or get on your face that touch your mouth, your eyes, or your nose, and then it enters the body and starts the infection. So if you've got a mask and it doesn't fit well, and you're breathing around you're breathing deep and the air comes in around the edges, or as I've seen some people do, pull it clear down under their chin, it's not going to do you any good. And it just gives you a false sense of hope that you're protecting yourself. But like I say, a lot of people actually, because it itches or bothers them, they're actually touching their face more, which is exactly what we don't want. So it's passed from person to person. The best thing we can do is to wash our hands. Washing our hands for 20 to 30 seconds with soap and water. That virus isn't very, very hardy, so it kills that virus and gets it off the skin. As a secondary, you can use a hand sanitizer, but we like to use those only when there isn't a soap and water around. And some places, a lot of places actually, are out of hand sanitizer. But there's a lot of soap and water around, so that works pretty well. And that's the recommendation on this. Obviously, if you're sick, stay home, don't expose others. If you can stand at least 6 feet apart, that also is helpful, because when you cough or sneeze, most of the particles you put out are very, very big particles, and they don't stay in the air past about 6 feet because gravity takes over and pulls them down. So in order to get the infection, you have to get enough virus cells or virins to have enough of an inroad to cause you to start to get sick with the virus. So if you get one here or there, you're not going to get the virus from that. So the very little particles that may go long distances, meaning more than 6 feet, they really have a low probability of infecting anybody. And really, the CDC, even when we were having a lot of people traveling back from Italy and Italy was having its problem, if somebody on the plane, they're sitting for 8 hours, if somebody on the plane the next day is diagnosed with coronavirus, we would go back, and the only people that were needing to be tested is the row that person was in, the row in front, the row behind, and the row across the aisle. And that's that 6-foot circle, because even with the plane recirculating the air and stuff, they weren't finding that a lot of other people were getting the virus. So that 6-foot circle is kind of really important. And while we want to be social, we want to acknowledge others, show our affection and stuff. Right now, we need to do that from a distance rather than up close and in person. So staying back that 6 feet is helpful.
Continuing on with that, are there any myths or misinformation out there that we need to combat right now?
Right. So I guess the main myth right now that I'm seeing a lot of questions about is my employer's requiring me to have a note to come back to work. They haven't been tested. They've got maybe a runny nose. And right now, with allergies the way they are, a lot of people have a runny nose or a little bit of a cough. So they're not going to necessarily have to. They're not going to have a note because they don't need to be seen. And employers, if they have real questions, are always welcome to call the health department and get some direction. And we're reaching out to those employers that are asking employees for that. But that helps lead into how we go about this. So if I'm positive and I have a test done, that test gets reported back to the state and to the Metro Health Department. we have a number of people that are reaching out to those positive people, and they're doing an interview that's lasting anywhere from 45 minutes to an hour and a half, and they're finding out where they've been, who they've seen, and all of that for about 2 days before they started having symptoms on. And then based on that, they're figuring out who those high-risk individuals are that they've been around, and they will call them and let them know that they are a contact of a known case and that they need to isolate themselves for 14 days. And the reason for the 14 days is because those people that have been exposed, in every case that we know of right now, has developed symptoms and the virus within 14 days. So if they haven't developed it within 14 days, they're not going to, and they can be released back to doing their normal stuff. But there is a process so that those people will specifically know, and in those people, we are giving them a letter, some information to pass on to their employer that says, yeah, I was really isolated at home because of an exposure, and so that their employer does know that. But that's probably the biggest other myth than the face masks are really helpful. They're somewhat helpful at best.
I want you to look into your crystal ball for a minute. As we begin looking at the staying inside all this time, and the governor just issued a stay-at-home order today, how long realistically should we plan to remain sheltered at home in Tennessee?
Right. That's a very good question. It really depends on what our growth rate of the virus does. And it may vary a lot from area of Tennessee to area of Tennessee, from county to county, from region to region. Right now, we have a stay-at-home order, depending on whether you look at the mayors or the governors, of up to a couple weeks. If you look to the president, he's actually recommending through the end of April, so that would be 4 weeks. But it really depends on what happens over the next several weeks. We hope to see a peak where we reach kind of a number and then we start to go down. But even as we start to go down, we're not going to want to let everybody go back to doing their normal thing right away, because that's just going to make the number go right back up. So once we do get past, we'll have to see that rate continue to go down, and then we will probably very slowly reopen and allow people to move about. We're probably about 3 weeks, at this point, we're about 3 weeks into our curve at this point. If you look at predictive modeling that's been done in the past, we expect probably around 6 to 8 weeks in these typical surge or waves, but it's hard to know. This is a brand new virus that we don't know anything about. That curve and that projection was made on the influenza virus, and that's, while it's not the same, it's the closest we have to be able to kind of compare it to at the moment.
So last question for me, and then we'll open it up to the community. Tonight there are over 60 participants on this call, representing neighborhood organizations that will impact about 35,000 households. As a medical professional, how can our neighborhood organizations, what role can we play in helping to fight this virus? How can we make sure we're providing accurate information, care for seniors and at-risk people, and really help create community cohesiveness? Do you have any suggestions for us on what we should be doing?
I do. I believe that New York has a really great kind of a grassroots program that started with some students wanting to help the elderly that were these high-risk groups. And they formed a coalition, and I think they're now, I want to say over 3,000 students that are helping do this, but basically they're working over the phone, computers, with the elderly to be able to go and get things that the elderly or those at high risk shouldn't be going out to get but they need. So it may be groceries, it may be medicines, it may be whatever. And what they're doing is they're having a conversation. So they're supporting them emotionally by that conversation, but physically by going and getting those things. And what they're doing is they're basically leaving them at the front door. They walk away and then that individual opens the door and gets whatever it is that they have needed. It allows them not to be exposed. And the older you are, and the more underlying medical problems you have, the more risk you are for having a hospitalization and potentially dying from this illness. So those very vulnerable population, that's one thing that we can really do. The other things we can do is really try and distance ourselves from those people. A lot of the stores are having like a senior hour or two, especially like the grocery store. But again, it's going to be washing our hands and then not sharing. If you know somebody is at risk, if you have any, even if you have don't have any suspicion, you really ought to stay away for now. Another key area not to visit is long-term care facilities and nursing homes. We are trying very hard to keep the virus out of those places, just like not visiting anybody in the hospital right now. And you may have seen some places are only limiting the mom and maybe the father in for delivery. In some cases, they're not allowing anybody in with the mother. And the reason is, once it gets into a hospital, that's a very tight, controlled place. And even though they're doing all the measures they can, what we've seen in some places is that it spreads between that population, and they are very high risk, and it can be very deadly for that group. So nursing homes, your parents, your grandparents, relatives, friends, neighbors that may be in one of those, they're there because they're probably very high risk, and now's the time to do things like FaceTime or even an old-fashioned letter. They still very much appreciate that because they know that the younger population doesn't normally do that, and a letter means more because it actually takes more work to do that, and so that can be truly appreciated. So those are the types of things I'd think about.
Fantastic. Thank you so much. If anybody has any questions, I'm going to remind you, if you're calling in and you want to speak, you'll need to do *6, unmute yourself, but please check and mute yourselves once you're done speaking so we don't have any noise. Any questions? We're going to take 5 minutes really for Dr. Gill and then move on to the next portion. Any questions for Dr. Gill?
Dr. Gill. Hello.
We hear you.
Oh, okay. This is Erskine Lytle. Just double checking. We've got a number of persons here who are in the high risk category for a number of reasons. And one of the things that we have been doing is calling on a fairly consistent basis. Some of us have just been calling them or stopping by and leaving a note, just checking on them. And you're right, there are some stores that are having senior hours. I think even Costco had one this morning, or Costco or Sam's or something. But are there things like, there's always this question about getting masks for everyone. And I understand that's being considered now. I've had 2 people ask me about that today. Is that something we need to be concerned with for our neighbors now, or can we still go along with if you're healthy or relatively healthy or not showing any symptoms? Can we just wait until we get that situation changes?
Right. So I would say, as I said earlier, this is a new virus and things change. I know there's been discussion about masks. But right now, the recommendation is that those that are well do not need masks. those that are ill, masks are a good idea. And there are obviously some people that need masks because they've got an underlying health problem and may be very likely to get an infection, even if it's not the coronavirus infection. It could be just they have undergone chemotherapy, their immune system isn't good, and they need to be protected. So at this point, masks, we really want to try and save for the healthcare teams that are taking care of these people, and that would be where I would say. You mentioned that you're calling on people regularly. I think that is wonderful, and I'm sorry it's taken us this kind of an illness to do that for our vulnerable populations, and I hope that after it's all over, as a society, we continue to do that because that is great emotional support for them.
Time for one other question. Anyone have a question?
I'd like to have some clarification. Did you say that you only show, if you're tested, you only show positive if you have symptoms?
The answer to that is a guarded yes. There are a few instances of people that do not have or have minimal symptoms, but the vast majority of people will have symptoms that when they are actually shedding the virus. And so because of that, in order to test the right people and not overload the system, everybody is recommending testing of only those that have current symptoms. And so yes, I know that there are a few cases where we've had reports of people that don't have any symptoms or say they don't. However, I bet if we really question them, they have just very mild symptoms. For instance, I walked up a flight of stairs today and I was a little short of breath. Well, I was short of breath because I walked up the stairs. But if you truly question them, you've been walking up that flight of stairs for 10 years. Have you ever been short of breath when you walked up? Well, no. So they had very, very mild symptoms, but they don't want to think they have the virus. They're putting that off on other things. But as with any illness, you never say never because it's going to be a very wide range of symptoms that people have that make up the overall illness. And sometimes the virus doesn't understand what we've labeled it as its playbook, and it doesn't follow them all the time. So given that, there is occasion when there is somebody, but that's by far and large is a very minor, small subset, and we just are not looking to those people because if I believe that I needed to test all of the asymptomatics, that means I need to do 750,000 tests a day, which would cover Davidson County, and I would need to do that until there were no new cases and then 2 weeks beyond that. So that would mean that I would, the first time they did 750,000, I would back up all the labs for a prolonged period of time, and we would get the labs back, so much longer after. Now, what we try and do is once we identify a positive, that's why we've got these epi teams or these teams going out or reaching out to these people. So once we get a positive, then we're figuring out where did you get it? That's part of the question. And who have you maybe given it to so we can limit that. And that's where we're really trying and reaching out to anybody that may at that point have no symptoms. And we may test those individuals if we have suspicion that there was somebody within it that was an asymptomatic carrier. But again, they're not going to be shedding that virus for a prolonged period of time, even if they don't have any symptoms. That they're not going to be a carrier and spread it forever. It's going to be a short period of time. So,
thank you.
Okay. Well, I'm going to let Dr. Gill get back to his other duties. If you have any questions, don't forget that you can call the Metro Health Center, Metro Health Department, and they have a hotline set up. Am I right? That number is 615-862-7777.
that is correct.
Okay, if you have any questions, call that number. Well, Dr. Gill, thank you for being with us tonight.
Appreciate it. Thank you.
And now for the rest of us. It is good to see so many longtime friends and leaders on here tonight. This certainly is a crisis that's impacting all of our neighborhoods and all of our lives individually. So it's good to be with you virtually tonight as we try to walk through this together. Let's just say, really, nobody's an expert. We're in uncharted territories, and we are really experimenting right now with what will work and what can't. There are some best practices, and so we're going to talk tonight. I'm not going to talk tonight. What I'm going to do is just ask you to share what your experiences are in your neighborhood. And even though not everyone was able to complete the poll, it was overwhelmingly preferred that one of the things that folks really wanted to focus in on tonight are what are other neighborhood organizations doing to safely identify at-risk neighbors and offer them important resources. So for those of you, and it looks like there's about 10% that are doing this already. If you're one of those neighborhood organizations that are trying to identify at-risk neighbors and offer them resources, can you share with us what you're doing? And if you would, just tell us your name and the neighborhood that you're with before you start sharing. And then the other quick thing is just to remember, if you're on the phone, it's *6 to unmute. And then when you're ready to mute again, do a *6 again. So who's doing what out there to really help serve our neighbors that are at risk?
Well, Jim.
Jim, I could talk for 50 Forward on behalf. Yeah, so for those of you who don't know 50 Forward, we serve older adults and we serve them. We do have a center. I'm the director of the center in Madison, but we have 7 total centers across Davidson, Williamson County, and we have our 50 Forward Fresh Meals on Wheels program. So that is still going. We are still getting meals out. Through our Bordeaux Center, we have identified people that are in need of meals. And so we do have a group of staff that are currently working to get hot meals and or frozen meals or shelf-stable meals to older adults. And so I put the intake line number in the chat there. So if you know of someone that absolutely has no one, they don't have family or friends or a neighbor that can get food and potentially medication if that's a need to them, then they can call our intake line and we will help make that happen for them. But if there is some family member or neighbor that can support them, we are asking people to do that. We're still running so we are also as well looking for donations for that so we can get food to people. And I can put our website in the chat. But is on the other side of things on the fact that older adults, what we do every day at the centers is combat isolation and keeping people social and active, which is challenging in this new environment. So all of the 50 Forward Facebook pages, we've launched a virtual content calendar for the month. And so we're asking people to tune in, and it's like anything you can, there are so many different things we're doing every day on those. So if you want to follow our Facebook pages, if you have relatives that are at home and they need something to do and have Facebook, that's one way they can get engaged. And then the other thing we are doing is we are calling every member that we have. So in Madison, we have, between more than 600 members, and we're making personal phone calls to every single one to check in, say hello, see how they're doing, and if they need anything. And so the other thing I'll say before I mute myself is just that if you know of older adults, neighbors, family, friends, please give them a call. It really does make a big difference in their day, and it's a little thing, but it can mean a lot to somebody. So.
Hey, Brandy, are you the only 50 Forward Center that's doing that, or are all the 50 Forward Centers?
So what we're doing is all of our centers are physically closed right now. We are functioning out of our Bordeaux Center staff only at this point as an essential service. So we don't have any volunteers helping us right now because of the stay-at-home order in place. But we're all working virtually, so we're all still working in one capacity or another. So we really are always one big team at 50 Forward. We're just spread out throughout the city. So, yeah.
Thank you.
Mm-hmm.
I have a question too. What age do you consider, Brandy, to be older adult?
So we are 50 Forward. So yeah, but I mean, yeah, so mostly for 50 and older. Mm-hmm.
Okay.
Yeah.
Thank you.
I'm going to share real quick on the chat room. The Council on Aging and Nashville Senior Ride shared a list of food and medication delivery options. And so there's a link on there if you need that information about who can get food and medication delivered. That's one resource for you as well. What are some of your other groups doing to really try to help?
Aging, who else? Say that again, Jim. What did you say?
Brenda, you're breaking up on us. What we're asking is, we're talking about at-risk individuals and how our neighborhood groups are trying to help those at-risk individuals. And about 10% of the people online said that they're doing something in their neighborhoods to help. So I'm wondering what all you are doing in your neighborhoods to help those seniors and at-risk individuals.
Yeah, but I heard that, but I didn't hear exactly what you said. You said it's something about Council on Aging and somebody else.
Yeah, the Council on Aging and
what else did you say?
Council on Aging and the Senior Ride Nashville put together a really good list of groups that are providing food and medication delivery options. So I've gone ahead and put the link in there, and I'm also going to put the PDF because I realized that it's a PDF as well.
Okay, okay. Now, some of the things that we're doing basically is just trying to stay in contact with our seniors and relatives and stuff here in Edge Hill. We usually have a food truck that delivers on Wednesday, but because MDHA has mandated that all community rooms be closed, and also that they didn't want, people on the properties congregating. I called up to the store. For those of you that heard about that, that's at Belmont campus. It's a store that Brad Paisley and Belmont partnered to get up there. And on yesterday, I was able to get them together, and that truckload of food was delivered up to the store. Now the store has a web page, and all you do is just go on that, and you can register people. And during this time, where they're not letting people come inside the store and shop, what they do is they deliver to our seniors. That's 65 and older, and people with disabilities. And pretty much that's I talked with Miss Jasmine up there today, and she said it was amazing, all the food that truck brought up there yesterday, but we do that like every week. Pastor Bart and his crew bring a truckload of food for us to distribute in the community room. But since it's closed, we're just referring those residents up there to the store so that they can get on their delivery list. And for anybody that wants to give that number, it's the store at Belmont University, and it's 615-460-8331. Other than that, what we're doing is just calling to check on one another and making sure that all of our people are staying inside and safe as possible.
What are some of the other groups doing? Maybe it doesn't necessarily have to be on service. Maybe you're dealing with one of the other areas. What are you trying to do in this time to better serve your neighbors?
This is JS from the Nations. I can talk a little bit about what we're doing. So something we did last weekend that was a lot of fun is we did like a sidewalk chalk event, and we bought a bunch of sidewalk chalk, had it at a local business that was doing takeout food, and basically said, anyone come get it if you want it. But then chalk your sidewalk, send us a picture of it. And we posted all the pictures of the completed sidewalk art on Nextdoor and on Instagram, and we said vote. And then the winners would get gift certificates to local businesses to try to support the businesses, even if they're closed right now, through gift cards. It was a lot of fun. A lot of people who have kids at home got to have them do something. And, you know, I don't have kids, but I've got to walk around the neighborhood, get some fresh air, and also see, you know, some cool art on the sidewalks, and it kind of created a sense of community. We also did a play on the porch where people played, you know, music from their porch. I would say that was maybe a little less successful because the really good musicians, people are walking around the neighborhood, tended to want to gather, and then other people would get upset because like, oh my gosh, 6 feet of space. But it was a really good idea, and I think similarly trying to build community in a time where a lot of people feel alone.
Thank you.
I can speak to what we're doing with the supportive women. We are.
Can you tell your name and your group, please?
Sure. My name is Fatima. I'm with the Supportive Women, SEEDS for short. So what we're doing is contacting each other, making sure that each one of us has a contact amongst the elderly population to kind of follow up with. And we're right now brainstorming to do more. And that's what brings me here, to hear what others are doing and to take back and see what we can do furthermore. An idea that came up is to perhaps do a virtual maybe yoga or deep breathing sessions, some kind of relaxation technique virtually as a group. So we're looking into doing more.
Thank you.
Hello.
Hello, you're on.
Yes, this is Garfield Delk. I'm with North Nashville Organization for Community Improvement. Our boundary area is between Jefferson Street and Buchanan and the railroad tracks on Hyman and over to 10th Avenue going to the I-65 interstate. I have a couple of questions I wanted to ask, and one is about the repair services. Now, we was hit with a tornado over here on March the 3rd, and a lot of our properties was damaged, including mine. And I'm trying to figure out, should we have repair service people to come to pick up the debris or whatever, to cut down the trees or get the trees up out of your yard or fix the house that was damaged? Should we have those people in our area and not knowing where they came from and what possibilities that they may have as far as spreading this virus into the area where we live. And then the second question is these delivery services. In my community where I live, we have a lot of senior citizens, particularly involved with the NNOCI group, that may want to have services brought to their houses, such as food delivery services, Walmart, Walgreens, etc., to bring these kind of services to their homes. And should we be concerned because the virus remains on certain objects, surfaces, for more than 24 hours. So if I got somebody delivering a pizza to my house, should I be concerned about that person may be infected and cause me to be infected with this virus? And those are my two questions.
Thanks, Garfield. Let's go with your first question first. We have on with us tonight Kathy Buggs and Fabian Bedney from the mayor's office. I'm not sure if they can speak to a little bit towards the recovery efforts that are going on and whether the Metro has any suggestions concerning cleanup in the midst of the virus.
Good afternoon, guys. This is Kathy. Fabian, are you jumping in or is it me?
Either one. I mean, we are both very happy to be here and try to help. So you go
You
first.
didn't answer my question about delivery. Should I have people coming to my house delivering food that's already cooked and other merchandise, because they may be contagious and may spread the virus to me?
Can I answer that? This is Kathy with the mayor's office. I'll touch on both of those for you. As far as the debris that you've got still in front of your house, is it just where you've had trees blown down, or is it parts of the house? What is it that's there? Mr. Delk?
He's muted his phone.
Okay, well, if he has debris that needs to be picked up, he can go to the hub and report that to the hub, and they will send someone out to get it, as long as it's something that it can be picked up by Metro Works. And as far as having something delivered to your house, as far as food, they are all saying that if you have delivery service, it's coming into your house into a paper plastic container, empty that food into your container, throw that container in the trash, and wash your hands.
And that's basically the only thing we can control is what we do. Nobody knows who has the virus or doesn't have the virus, because many people can have the virus and don't be symptomatic. So we are asking people to stay at home, wash your hands often for 20 seconds, don't touch your face, try to stay away more than 6 feet from other people. And the idea is just each one of us do our best to keep away from people that may or may not be infected with the virus. Now, I think what he was asking is, if I understood correctly, he was concerned that we were sending repair people to his community to do repairs right now, people that may be infected with the virus. And obviously, we take great care on our employees, and if anybody is even remotely has a fever or any of the symptoms, we ask them to not to go to work. I mean, it's something that we get emails from HR every day asking people not to endanger themselves or others by coming to work if they have any symptoms, and to get tested and all that. So I feel very confident that as the people who work for Metro are being very proactive in trying not to get sick, just like I am. Many of us in the mayor's office are working from home precisely not to get sick. So I think the likelihood of Metro employees spreading viruses to other people is.
No, I was not talking about Metro employees. I was talking about people that I have hired, private contractors, to come over to do whatever recovery or repair work that I need to have done on my house. Should I be cautious about just having these kind of people that I have no idea who they are and where they're from to come over to my house and have personal contact with me, because I've got to talk with them about what I need to have done on my property? Should I have those people or anybody come over to my house to do any work, and I don't know if they have the virus or not? That's my main concern.
That's a great question. It's a question for the doctor that was just here with us. Now, I personally wouldn't let somebody come to my house that I don't know if it's or not. So each one of us need to use our own judgment. But I think you are right to be concerned, but I'm not a medical expert to give you advice. I can just tell you what I'll do. If it was me, I will postpone the work and just wait till a month from now when things die down.
Okay, that sounds great. I appreciate it.
Hey, Jim, this is Councilmember Brett Withers.
Hey, Brett.
The kind of the guidance that I'm seeing from other states, as well as here locally, is that even from our codes department, is that the danger sort of emerges when folks enter the home. So if these are repairs that are being done on the exterior of the home, they are probably okay. You would still want to maintain social distancing. You wouldn't want to shake hands. If you needed to sign a document, you might want to use your own pen and not theirs or something like that. But for those of our neighbors who have storm damage, you need to get a roof on that building as quickly as you can. You can't wait, because this virus will be with us 1.5 to 2 years until we all have a vaccine. So if you have home repairs that are needed, you need to go ahead and get those done if you can. But the danger, even with our codes department, is with having personnel come into the home, but work on the exterior of the home is probably okay. You would want to minimize face-to-face contact with people as much as you could, but go ahead and get that tree out of the yard or any of those dangers removed as quickly as you can. But just be really, really careful about folks entering the home.
Great. I like the answer. Thank you so much.
Councilman, thank you for that comment. That's what I understood, that he was concerned about people coming inside his house. That's what I was speaking to. But thank you for clarifying that.
Someone else.
Hello, Jim.
Yes.
Jim.
Dan. Hello. How are you?
All right. How's everybody out there today?
Good. Good to have you here.
I'm calling from Bellshire Estates. Yay, yay, yay. And Jim, what we've basically done is took some suggestions on what you would give us when you were out a few weeks ago. We make sure we have tried to contact everybody. And what we did basically was just went on to the Nextdoor network and let everybody know that we're making ourselves available to them if they need something. I mean, whether it's going to the doctor, not going to the doctor, I'm sorry, going to the pharmacist for them, picking up groceries, or just whatever the need may be. We're kind of stepping out on the limb there to help people, because our neighborhood basically, Jim, is, I would say, mostly elderly. And we've really, really tried to reach out to them. And I've seen a lot of others that have been on Nextdoor that have pretty much done the same thing. But what we've actually run into is that a lot of those folk, a lot of us, let me just say us, are not Nextdoor literate. Some are and some aren't. So it has been a struggle trying to get people to understand that we are, opening ourselves up for them to be able to help in any way that we can. So that was basically it.
Thank you. Thanks, Dan. That is a challenge. We're thinking around here that one of the things that, if you have it already set up, it would be really effective is the traditional block captain. Block captains have a tendency to be able to know who lives on their block, what their needs are. I know that Wacey Zanu sort of acts as a block captain in her own neighborhood, watching out for everyone there. But you know, that system of having block captains, of having someone in each area who knows the needs and you know, that each group has, is really helpful. I don't know if that's something that can be set up right now, but as we look towards the next disaster that may be coming down our road, that may be something that neighborhood groups need to consider. Anyone else want to share?
Jim, if I may.
Hi, Andy.
Hi, I'm Andy with the Donaldson Hermitage Neighborhood Association, but I'm also an Uber driver. If you want food, if you're having food delivered to their homes, all Uber drivers that I know of, and I've been talking to Uber's been talking to us and everything, and they've given us the ones that have been delivering food. They have gloves, medical gloves that they're wearing, plus they're in containers that cannot get food contaminated. They don't touch the food at all or anything. So, and I do know that all the restaurants that are providing delivery service are wearing gloves as well.
Thank you. Thanks for letting us know that. Someone else, what are you doing in your neighborhood? Or if you have a question about something you think might be a good idea.
Hi, Jim. This is Sam McCullough.
Hey, Sam. How are you doing tonight?
I'm doing well, thank you. I've enjoyed hearing from everybody.
You're from Cleveland Park, right?
Right, Cleveland Park Neighborhood Association. Thank the Lord, the tornado pretty much skipped over us. Unfortunately, it hit the other side of District 5 and did a lot of damage, and especially over in Councilman Withers' district. I've got some friends over there that they got missed by one house. So anyway, it's good to hear everybody. I was listening to what he said about this may be with us for a year or two. It reflects back on a conversation that I had with a friend of mine in Ohio earlier today, and who made a comment that he'd heard that this is possibly round one of this spread around the world, that this has he said he heard it had the opportunity to come back and like start all over again in making wave 2 of the same thing. And I was just wondering if anybody had heard that, and is this something that we're going to possibly have to make adjustments to as we, you know, as a society? Is this going to be the new norm? Right now, Cleveland Park, we pretty much canceled everything as far as events and doing things like we ordinarily would do. But I just was wondering if anybody else had heard that as well, because it's a strange time that we're in right now. And it's so sad. We need to connect more, but unfortunately, everybody's having to work from different spots in their home. I've been on more virtual meetings the last few days than I have been out of my house. So anyway, I just wanted to share that, and I just was wondering if anybody had heard anything else. And I'll mute myself back, and I hope if anybody has heard anything, would be willing to share what you've heard with everybody. Thank you.
Thanks, Sam. And I think, nope, I'm not trying to talk. Yeah, I actually have heard that at least this fall, there's the potential that we get another round of this. And that is a big concern that people are having. You know, I want to talk about one positive thing that's happened in my neighborhood. And that is that I live over in historic Germantown. And for the last year, we've had people move into the houses, and they seem to disappear into their house, and we never say hi to them. But now that everybody's home, I'm finding that my neighbors, especially on warm days, actually coming out of their house. And so I've physically distanced myself from them, but I've met some new neighbors that I just haven't seen before. So I was a little bit thankful about that.
Jim, you live in historic Edgefield.
What did I just say?
Germantown.
Hey, okay. I'm looking on the screen and seeing someone, and I'm getting all confused. Yeah, thank you, Valerie. She also reminds me of my name as well. So I appreciate it.
Hey, Jim?
Yes, yes.
This is Erskine. From College Hill Neighbors. And
good evening, Erskine.
How are you?
Good to see you.
Good to be seen. it is, there are two things. The first is I drive for Lyft, and one of the things I've noticed is that there are more people actually talking as opposed to spending all their time on their cell phones now. They're standing further apart, obviously, but they're actually involved in conversations, and that's a good thing. The other thing is that we are. It's not everyone in the neighborhood, because we weren't able to get together to arrange just a couple of phone calls amongst us, and we are trying to identify those of our neighbors who are seniors, as I am, but we're trying to find out, those of us who can are trying to identify needs and and then address them as we can. And you know, it goes to doing groceries or ordering food and having it delivered for them.
Thank you, Erskine. So we're coming up on the 1 hour mark. We don't have an agenda here tonight other than to bring neighborhood leaders together. And so if you're expecting some great decision to be made, you're going to be sorely disappointed. But we're going to continue on for a little while and talk some more. If you have to leave, it's okay. This is just like neighbors getting together and talking. And if you got to go do some other things, that's fine. But I want to leave this open for folks that want to continue the conversation. And we'll probably be back here again next Thursday night doing the same thing, because we're all trying to do the best for the neighbors where we live, the neighborhood where we live. Sometimes that can be a little bit stressful, and it's nice just to have a group of people that understand our pain and that understand our struggle. So we're going to keep going, and whoever wants to talk can talk, and if you have to get off, that's fine. Don't feel bad, but before you leave, just let me say once again, thank you for your service. Sometimes this is sometimes a thankless job, but every effort you put into making your neighborhood a better place to live, it's just greatly appreciated. And it does make a difference. So keep doing what you're doing. All right. Anybody else have anything they need to or would like to share or talk about?
I would.
Just wanted to say good night, everyone.
Good night, Andy. Good night, Mary Beth, Joe Bob.
Hey, Jim, this is.
Yeah, I have to go too. Nice seeing you all. Bye.
Bye.
Will there be a recording of this available?
Yes, so we're recording now, and it will be on our Facebook page, and I will actually send it out. I think, I'm still learning about this, but I will send it out in an email tomorrow to everyone.
Okay, thank you.
Thank you.
Jim, I wanted to say something
Trish.
about this. Trish from Caldwell Abbey Hall and Neighbor to Neighbor. And I wanted to point out that we keep using the expression social distancing. And yet here tonight, we're talking about not socially distancing ourselves from our neighbors. And I'd really like to see us start using the expression physical distancing rather than social distancing. Today on the news, I saw a lot of stuff about suicide hotlines and how people are feeling so alone, and they're in such despair because they think this is going to be such an awful experience and don't know how long this will go on. And I think the more that we use the expression social distancing, it adds to that anxiety. And I think we want to physically distance, but we do not want to socially distance.
You know, Trish, this is Brenda Morrow with the Edge Hill community. I feel the same way you do about that. That social distancing is like that you're being antisocial and all that stuff, and the physical distancing sound better. It feels better. And my concern, you guys, and by the way, let me just say, it's so good to see all of you guys. You never know how lonely it is until you don't get to see familiar faces for some long period of time. But my thing is the people that are feeling so lonely, the people, there was a lady called me and she was like, Miss Brenda, are they passing out the food? Because I can't get over there and y'all usually bring me mine. And I'm letting her know that because I can't come in her house and I can't come and hug her or anything, can I refer you to the store where they can deliver your food? But I just felt so bad that people are feeling so lonesome and people are so depressed and so, you know, all this stuff that I'm hearing. And then when you get phone calls in this resource center or on my cell phone and people are expressing what I'm hearing on the news, it just tugs at my heart. I was late logging on, because in the midst of all of this, my baby sister is going through an episode again where her medication, she's bipolar and her medications get jumbled up. And I have been over to the Parthenon, the Centennial Hospital Emergency, simply because I had to go get her checked out and everything. And again, like this time, they will send her to Parthenon Pavilion where they'll get all her medications regulated. But my thing is, like, in the midst of this virus thing and dealing with people that, especially seniors, this lady is 95 and she's so lonesome. And I want to go and just hug her. You guys know what I mean? But you can't do that. Right. So my main concern is how do we, and somebody was talking a minute ago about doing a neighborhood watch or forming a block captains and things, but I'm seeing that the telephone calls are what's needed most. If you can just pick up the phone and call people, or I found myself last week going through one of my sign-in sheets, just calling people. So I don't know how y'all deal with that, but I'm just letting y'all, I'm just sharing y'all my pain. This is
I understand. We understand.
And I'll be quiet and mute myself again. But it's good to see everybody that I can see.
Good to see you too.
I have a question. Hi, this is Gina Coleman with Haynes Park. And I have a question. Hi, guys. It's so good to be on the line and just hear you all, to hear your voices. My thing is that, because I've got my roster here and I'm going to be calling people. And has anyone got on Zoom or any other platform and just did a conference call with all the neighbors? Because you know, we can't meet at our regular meetings. So has anyone just conferenced together and taking care of neighborhood business like that, or just checked on people? And just like Brenda was saying, that that's what she's looking at, her old sign-in sheets or maybe her rosters, and because I think that's what I'm going to try to check in to see if we can do a conference call with everybody and just get everybody to call in and see what we can see how everyone is doing and what they want to do. I kind of got talked to my president, and he was really saying, well, let's just lay low and see how this is going to play out. And so not wanting to put yourself in jeopardy right there, but taking care of your own home first before you take care of anyone else's. So making sure that, you know, you're good and you're healthy, and then we can look at reaching out to other people. But, you know, staying within your, it may not be 10 house cluster, maybe 5 house cluster. I went next door and took my neighbor this, you know, I'm after this chili cook-up, I'm just loving to cook. So I just made some beef stew with beef tips and took that to her. And she's about 88 years old, and she really liked that. So I may not do the 10 house cluster, maybe just 5 house group, or the ones that I know that are in that 88 or that, you know, that age group, and just take them a little plate or something, make a cake or take them dessert and just sit down and chat with them. And I really enjoyed that, and she enjoyed that. So that's what I've done at the closest local level, my next door neighbor. Within my little 5 group, I can and talk to my neighbors or maybe doing their little 5 group and just reaching out like that.
Well, I can certainly speak to the conference calls here. We've gone exclusively to that. We started using free conference call because it was such a good, it was free. But I have to say,
we like free.
We've had some real problems in that, and Valerie and I are both about the same age, and we don't like them because we can't tell body language and we can't really hear well. So we moved over to Zoom, and it's nice to be able to see people. And Zoom is free, also. You can set
I didn't know that.
You can set up your own account. Now, during this time, there are times that people can't call in unless you pay for it. But generally speaking, you have at least 40 minutes up to an hour that you can have a conference call with up to 100 people on it.
Oh, that's good.
Anybody else have any experiences with conference calling, video conferencing they want to share?
Well, this is Garfield Delk again with NNOCI. Our management team, which I'm a part of, we have decided to do conference calls for our members. We have about 30 members, and we haven't met since February of this year. And I don't know how long this is going to last as far as us not meeting physically. But we have set up a phone line, the teleconference, where if we can't meet for another month or 2 or 3, we will call all our members and give them that access number to let them know that we're going to have a meeting over the phone so we can keep up with the businesses that's going on in the North Nashville Organization for Community Service boundary area. So we got that already planned, but we hope that that won't have to come to fruition. Hopefully we'll be able to meet at least in May. But right now, that's not a possibility because of the extended time frame that the mayor and the governor has required us not to meet in more than 10 people. So we're on board with doing something like that, but we hope that that doesn't have to be executed. And that's a possibility that it may do, because we may have to do that because we don't know how long this virus is going to last and how long our neighborhood association is not going to have an opportunity to meet, because most of our members of the North Nashville Organization for Community Improvement, we're over the age of 60. And we know that that's the most population that is more susceptible to this kind of virus. So that's a possibility for us. We're going to execute that if it's necessary so that we can keep up with the business that's going on in the NNOCI area.
Gina, back to you. The one thing that we can say is we're doing this in East Nashville right now. We can offer our Zoom service since we have a paid service. If you want to have a Zoom meeting and have everybody call in, we can certainly use our free account if you feel, or our paid account if you feel like that would be helpful.
Oh, that would be great, Jim. Let me talk to my board and see what we can set up, and I'll talk to you offline about that. But thank you.
Hey, Jim, this is Councilmember Brett Withers again.
Hey, Brett.
I'm sitting on my porch. I'm apologizing if it's dark. I'm enjoying some outside time. But, one of the things that's really struck me, I have at least 2 family members who are nurses. And in at least one of my cousin here in this area who is a nurse, she is physically separated from her family because once she gets home, she literally can't take a risk of hugging her husband or her children because of that risk of infection. And that really kind of drives home to me how difficult it is for medical professionals in our community that I think like right now, they need a lot of very, very special support. And I'm just wondering if anyone has experience with that in your neighborhood groups where you have folks who specifically are really on the front lines of being a first responder. And if so, what are some ways that neighborhoods have worked together to kind of surround those people and thank them for their sacrifice that they're making, where they may be able to come home but still have to actually separate themselves from their own families? Just wondering if anyone's encountered that yet.
Great question.
Hi, everybody. Brett, and this is Jackie Handsome. I'm in Eastwood as well. Brett, I'm thinking about that a lot too, as it affects some of my close friends here, especially. And I don't specifically have something to say to that, but I did want to say before, and I was having trouble unmuting myself, but as far as Zoom, we've been using it with different groups I meet with for work with NASA, so like after school and the YMCA, and the breakout rooms could be a really good function for us as neighborhood folks. And another thing I wanted to bring up about Zoom, just because I know for us, we'll be putting our invites out kind of Facebook, Nextdoor, publicly. There have been a lot of instances of hacking. And so just be mindful of like how you strike that balance of getting the word out, but also I have been on some Zoom calls in the past few weeks that have been hacked. And so we're going to have to be really mindful. And what that could look like is sending out a very specific password to your people that sign up, figuring that out and making sure they sign in with that. Otherwise, there can be a good chance of the hacking situation happening because we're going to have to post it publicly. And Jim, I can send y'all a guide that I got earlier that's pretty short and easy to scan about like some tips for Zoom. And if that's useful to anybody, they can look into that.
That would be great. Thank you.
Sure.
This is Trish again from Caldwell Abbey. Not exactly to your point, Brett, but I received a message from a neighbor on Instagram, and she took a photo of a note that she received from a neighbor on her block who said, "I am a doctor. I know there's a lot of scary stuff going on, and I work in the emergency department, and I'm happy to answer anybody's questions if they have any questions about the virus," which I thought was really wonderful. And he put a note in everybody's mailbox on the street. So he was reaching out to the community, which I thought was just a really great thing for him to do, or her. I don't know who it was, but he didn't sign his, they didn't sign their name. They just said, "I'm a doctor and I'll be glad to answer your question." So I think that just goes above and beyond. They're killing themselves in the hospital, and then they're go, "Okay, when I get home, I'll answer more questions for my neighbors." So I thought that was great.
So I just got a private email from Wendy Windsor saying, "Get Wacy Zanu to talk about what she's doing." So Wacy, you've been put on the spot. You got to unmute yourself.
Hello, everyone. Thanks a lot, Wednesday. Wow, I don't do this all the time. I'm not. Well, what I try to do is sit on my porch and wave to people. I have a lot of people who walk dogs, they're with their children, and I'm on my porch and I'm waving. When I walk from my house, do my little walking, I speak to people and people speak back to me. And I think that it's going back to what Trish said, we cannot socially isolate or distance ourselves from each other. It's important that we remain safe and we do what we have to do to be safe. And the physical distancing, we understand what that means. But it is vitally important to, as safely as we possibly can, to maintain social contact with each other. And sometimes it might just be putting a book on your neighbor's door and send them a text and say, "I've been to your house. It's a book there you might like." And I think that's a nice thing to do. And I enjoy doing it. And maybe other people might like to do it as well.
Thank you. Well, we're coming up on the 8 o'clock hour. Is there anybody that wants to make a closing remark before we close out for this evening? So quiet. I love it. Well, I want to give a shout out. I saw Wim Coddington and David Padgett. I haven't seen David Padgett in about 7 years. It's so good to see him here tonight as well. So thank you all for being here. We'll share this tomorrow night, and we'll be back next Thursday night to have a forum for neighborhood leaders to talk. Have a good evening, everyone.
Good night. Bye.
Thank you, Jim.
Good night.